Okay, welcome.
Hello,
We got
hello.
Adlin here. Welcome, welcome. We're so excited to have you. As you're getting settled in and getting yourself situated, feel free to drop in the chat where you're from, whether you are pregnant or postpartum, and if you have any challenges related to feeding or playing or carrying or any concerns, worries, things that are on your mind. So, where you're from, whether you're postpartum or pregnant, and maybe any things that are on your mind in terms of feeding and playing and carrying and posture, all those good things.
We're going to give like 1 to 2 extra minutes for other folks to join. Oh, Mama, congratulations.
Yes. Oh my gosh. Definitely congratulations. Also, I used to live in Boston for like 2.5 years for grad school. So, definitely familiar with that area for sure. Welcome, welcome. Adeline, if you don't mind me asking, how did you hear about us? You can pop it in the chat too if you like. And Kimberly, welcome, Kimberly. Welcome, welcome.
I
Hey, Adeline.
Yay.
Am I pronouncing your name correctly?
Yeah.
It's
Okay,
Yep.
pretty.
I don't even know. I don't remember how I found out about this.
that's
It
all
might
right.
have been searching through Eventbrite or some website. I don't know. I can't even remember.
Awesome, awesome. Well, we're excited to have you here. We're so grateful that you came into the orb, came into the sphere, that we got connected. Um, Welcome, Kimberly and SH. Oh, Kimberly dropped. SH, welcome. As we're getting settled here in the chat, feel free to pop in and place where you're from, whether you're pregnant or postpartum, and then if there are any concerns, any challenges that you have related to playing or carrying or posture or anything like that. We'd love to hear.
Adeline, is this your first if I'm not too much in your business?
Yeah, it's my first.
Yay. Yeah, it's exciting. I was like, no matter what number, it's still very
Yeah,
exciting.
for
Yes,
sure.
yes, yes, yes. Awesome, awesome.
Okie
So
dokes.
we will go
Oh,
ahead and get started. People will probably be popping on. Full disclosure, we had a plethora of people sign up from the UK. And it is also like very late
midnight.
slash middle of
Yeah.
the night there. So lots of folks are going to be catching this replay. No problem, no problem. But we'll go ahead and get started because we want to honor everybody's time here. We are very glad you're here. We are going to talk to you today about posture, play, and positioning for mamas. And welcome, SH from the UK.
Oh,
Um,
you're a trooper. You
a
go.
trooper, a true trooper. And so we know that pregnancy and postpartum, they always bring such great joy. We get it. And it can also bring some unexpected physical things that happen, unexpected physical challenges. So today we're going to go through posture and feeding and play strategies that are going to really help you set yourself up for success, so that you can move with confidence. So today we're going to go through the why behind our mission. We're going to talk with you about how to effectively use your posture to help prevent some pain there, particularly in pregnancy. Then we're going to walk you through some quick releases, so some stretches, some rolls, some things that are going to really help you set yourself up for success. We'll give you the best positions for play and feeding. And then we're going to teach you how to lift and carry while you can support yourself. Then we'll further dive into how you can get some further support during pregnancy and postpartum. So let's dive in. First, let's talk about who we are in the first place. So we are doctors of physical and occupational therapy. So we're actually a trio. Dr. Saiah is here with us today. She's with us today. And then I'm Dr. Valerie. And we also have Dr. Lisa. And so we really saw a need in the maternal health space. I'm a mom. Um, Dr. Lisa's a mother. Dr. Saiah sees plenty of mother and is a maternal health specialist. We all are trained in pelvic health and maternal health and obstetrics. And we really saw a need that in this population, and we wanted to serve you well. So we have 3 kids between us and hundreds of patients between us, and we built the Balanced Mama Project to bring about some prevention and awareness, and really ultimately freedom directly to you as our mama. Let's dive in.
Okie dokes. And so we put up this slide and we say, or not even we say, it's shown that 70% of all pregnancies involve pain. And so why do we say this? Many times, or we should say, understanding pain during pregnancy and postpartum is crucial. Many times people normalize pain during pregnancy. And it's like, oh, you're pregnant. It's okay. You're just going to be in pain for the whole pregnancy. And it's like, no, like, oh, you're pregnant. Oh, your back hurts. Oh, you're pregnant. Your hip is going to hurt. Like, no. Yes, these things can come up. We prefer the prevention strategies, but if they do come up, many times we like to let people know it is not something that you have to deal with for the whole time period. We say address it early. Sometimes people will tell you, oh, it's going to go away in postpartum. And sometimes, yes, does it? And sometimes, or many times, no, it doesn't. And then you still have to get it addressed. And so we say without proper guidance, many people will normalize it instead of doing prevention efforts, doing efforts to address it. And so we say with proper guidance, though, we like to say, help alleviate discomfort and enhance the overall experience for new moms. And it is important to note that there are high correlations between increased pain during that pregnancy time period and postpartum depression. So we're like, no, address this early so that we'll have less issues in the longer run. And to make it less scary. If the pain comes up, yes, get it addressed. It's not the end. Okay, so let's talk a little bit about pregnancy posture and how the body is changing. We are going to move a little bit during this section. You are welcome to move with us. You do not have to. It's up to you. And so let me get us started. And so first, how does posture typically change during pregnancy? So as the baby bump is growing, typically your center of gravity, so where you carry most of your weight, is going to shift. So you might start to feel a little bit more of a pull forward. Or if you notice you might be tripping more. I hear a lot of moms where even the stairs get a little dicey. When you say, hey, just notice your center of gravity shifting, so you have a little bit more pull from the belly, and then your back, your hips, your abdominal, so those core muscles, and your pelvic floor muscles are working overtime. I do tell the mamas, your core muscles are still trying to work even while they're under stretch. And same thing for the pelvic floor. And so I'm like, imagine, I was like, I hope you can still see my arm. If your biceps, you're trying to lift something and you had to lift everything within this range instead of being able to fully bend and fully extend. It is a lot harder for the muscles to work. Oh, and then I like to tell people, I hear mommies discussing mom butt all the time. Your butt does not disappear during pregnancy. Just because the belly is pulling you forward does not mean your butt is gone. However, for those who are wondering which muscle groups to work out, actually those glutes, so your glute muscles, your hip abductors, the ones that bring the legs out to the side, the muscles that bring the legs straight back, your hip extensors, they are working the hardest during your pregnancy. So if you're trying to work out, please work out those hips. Keep that body nice and stable. Okay, we're going to try out 2 different pregnancy postures. You can do them, but you don't have to do them. I was going to say if the bump is bumping, we might feel a little bit crowded on this first posture. So if you are slouching throughout the day, if you notice yourself kind of hunching down, notice in that first picture, the back muscles are all stretched out, and then our core muscles are all smushed up in. I was gonna say we're cramping a little bit where the baby is. And so same thing, I say your pelvic floor muscles are short in this position. Abdominal muscles are short. And a lot of times it's not going to be the most comfortable with that forward head posture. I was like, we can't have the mamas getting neck pain. And so if we switch from this position to having your feet nice and supported on the floor, and then you want to keep your ears, your shoulders, and your hips in line when you're sitting. Um, Notice, notice how it feels to take a deep breath when you're slouching and exhaling. And then notice how it feels to take a deep breath when you're sitting upright, ears, shoulders, and hips are in line. See if you feel any type of difference between those, or if the belly feels less compressed.
And if you're doing it with us, feel free to pop it in the chat, what you're feeling, what differences you're feeling between the two, whether you're feeling when you feel like you can get the deepest breath.
And so we say thanks, Dr. Val. Um, and I tell people, are you going to sit straight up all day? No, I don't do that. I do not have a baby bump bumping right now. But there are different supports that you can use. So oftentimes I will tell my mamas to place a towel roll or something behind the low back, behind that tailbone region, because if you support the pelvis more, it's a lot less likely that you'll hit a slouch. And then you don't have to work as hard to sit up all day. And so I often say you just want to modify your environment. So we like the towel roll, and then be mindful to change your movement patterns during the day. And so what this means, if you need to stand up and stretch, we're going to do some mom moves in a second. If you need to take a break, and we're going to do some arching and some pelvic tilts in a moment. But if you're sitting a long time, you can arch. You can roll in and out of the slouch in the extending, just to give the body a chance to move and take you out of that. If you notice you're slouching, take you out of the slouch position. Sometimes we just got to move a little bit. And then we can do a nice reset of our posture. Dr. Val, I can't see the chat right now, but if you see something good, feel free to shout it out.
Yeah, no worries. SH was letting us know that they felt the difference, and so I was commenting, "Yay, that's great." So, all good. Keep it rolling.
Yes. Okay, so let's talk about, I was just running a maternity class maybe a couple weeks ago. And we were talking about how you get neck pain if you're sitting, or how the body gets tight when you're sitting. So let's even talk about some stretches you can do, especially if you have a desk job, if you're a video gamer, if there's anything where you're sitting for a long time. Feel free to join me for shoulder rolls. We're going to do like 5. And just taking a moment, you're taking the shoulders up, mostly back, and then down. So I don't want to see the shoulders next to the ears. Usually it's tight enough. Gently up, mostly back, and down, and making sure to keep breathing.
If you
And
notice
so I
that you're
usually will
not
stress
able to,
breathing.
go
Hmm?
ahead, Dr. Saiah. Go ahead, Dr. Saiah.
Oh, I said I usually stress breathing because sometimes when things are difficult or if we feel pain, the body's reaction is to tense up and to not breathe, which makes it harder overall.
Mm-hmm.
When we talk about neck stretching, I'm just going to ask you to lean an ear to the shoulder. See how it feels to feel the stretch on the opposite side of the neck. Taking a nice breath in and a nice breath out. And then usually if you're doing stretches, I'll coach people 5 to 10 breaths or a cute 30 seconds. It is up to you and how your body feels though during the day. You can also look down towards that armpit. You might feel the stretch more at the back of the neck. When you get set up for these stretches, make sure you're not starting from that slouch position. Try to sit up as nice and tall as you can before you get into the stretch. And so even looking down towards the opposite shoulder. And so you can do these same things on the opposite side where you're stretching and then looking down just to make sure the back of the neck doesn't get too tight. And then if you're like, oh, I need a bigger stretch still, you can clasp the hands, take them up overhead. We're going to do a seated cat-cow, so similar to the pelvic tilt. You're going to lift through the chest, extending those hands up. Big inhale through the nose. And then we're going to let the cow float back down. Y'all, I always mess up the cat-cow. I'm not going to lie. I don't know which one we're in right now. Go ahead and
That's
exhale.
all right. We are in cat right now. And
Okay.
then when we arch, we're in
Arching.
cat.
Yes, you'll see Dr. Val for the top motion. You will see me for the bottom motion. And so last one, big inhale and big exhale. Letting the back round out. Very nice, very nice. And then my last one is going to be opening up the chest. If you can clasp the hands behind the back. So this motion, but behind your back. And then you just want to lift up the chest towards the heavens. Y'all, I'm a Tai Chi instructor, so if you hear nature references, that's why. Take a big breath in, looking up, and big exhale. Big inhale, and big exhale. And so those are all options just to get you moving during the day. If you're feeling tight, sometimes all it takes is a few extra motions to be like, all right, let me loosen up my body, let me reset, and go from there. And so now, let's get into what some of you may have been really here for, positioning and feeding and playtime.
And playtime. Okay, so we recognize that this can be a major concern, and this can be a situation where we have the most discomfort during feeding or playtime. So let's get into what techniques and tips we can use to decrease that from happening. All right, so I have to shout out this mom that I was working with for a little bit. She came in for PT and was having some neck pain, and um, honestly, this was her second time around. So she had a kid the first time, um, but this was her first time breastfeeding, and so she was noticing that she was having neck pain, upper back pain, but then she also started noticing that she was having headaches. All of those things are very much so related. So we assessed, well, what's going on with your feeding and what's your posture looking like. She actually honestly looked very much like this picture on the left. So we assessed this where, her chair is pretty wide and her legs were kind of propped up, but maybe not putting her hips in equal alignment. And then she was holding the baby, and you guys, listen, I've been there. It is so, so nice to look down and see that precious little one that you're feeding. I get it. I get it. And that can be a lot of times what is contributing to that neck pain. So, what we did is we did some posture adjustments with her. So, we made sure that she had some supportive pillows. What does that look like? Well, underneath your forearm, so the baby's head is cradled in your elbow, right? And then we place a pillow right underneath your forearm to give you that support. Now, you don't want that pillow to make your shoulder come up to be your earring, right? And you don't want your shoulder to drop all the way down. So, you're going to make sure that that pillow is supporting you so that your shoulder is nice and relaxed and your elbows just bent at a nice 90-degree angle. And so Dr. Saiah is demonstrating that for us right now. And if you're sitting in a chair, which we recommend, if you're sitting in a chair that does have armrests, we want to make sure that it's narrow enough so that your arms can fit in it. I was joking with Dr. Saya the other day that chairs just really a lot of times aren't made for ladies, aren't made for women. So they're made for men who have a bigger shoulders, broader shoulders. So if you can, we want to find a chair that is going to give you that support with both of your arms so that you're nice and comfortable. If you don't have that, or let's say you are breastfeeding from a sofa, right? You're going to want to go all the way to where that armrest is on the sofa. Place your arm there, place baby there, and the elbow that is against that is yes, against that armrest. And then what you're going to want to do is you can get some pillows to prop up the other side of you, or you can just rest back, which leads me to my next point. You're going to want to make sure that your upper back, your neck, your head are also supported. That's what gets missed oftentimes because, again, we're looking down, we're gazing, we're saying, hey, cutie patootie. And we want to glance and lift back up and just kind of rest our heads, right? Our feet, in terms of our feet, the reason why you want your feet to be supported, so check out the lady here in to our left in our left picture. The reason why you want to be supported is her hips are a little bit twisted. Now her knee is above her hips. And all that is going to do is put a lot of pressure in that low back. So, what you want to do is have some nice flat feet on the ground. You can use a stool. I'm a shorty. Dr. Saiah and I are shorties. We're about 5'1". So the chair I was using was made for more my husband's size, and therefore I had to use a stool. So I used a stool while I was breastfeeding. But you want to make sure that you our supported feet are evenly placed on this supportive surface or the floor. And then, most importantly, you're going to want to make sure that your knees are in line with your hips. So, your knees are not above your hips, as if you were using a squatty potty, and your knees are not below your hips, because either or is going to affect your body and cause you some back pain. Now, I want you to think about this. Newborns eat about 7 to 8 times a day, sometimes more. And then you're doing 30 to 45-minute feedings. So if you're asking your body to do this for a long period of time, you're going to want to make sure that those muscles are nice and supported. Think relaxed as much as possible. And with increased relaxation comes increased breast milk production. And if you are bottle feeding, because I did a lot of bottle feeding, we did a lot of formula feeding here in this household, even still, you are going to want to allow your body to relax and rest as much as possible. Motherhood is no joke. So give yourself a break. Give yourself a break.
Dr.
Um,
Val, you
yes, Dr.
probably
Saya.
saw this. There was a question on if there was advice on low back posture. I would say your points with resting the feet on the floor, knees in line with hips, and even the recommendation from our last bit on putting a towel roll or something behind the back. So no, you don't want your back super arched. Dr. Val, if you have more to say, I don't want to cut you off.
Mhm.
But a lot of times if you can keep things in alignment. So we're going to say ribs stacked over hips. So if you have something to support you, even if you're leaning back, you notice you can still kind of stack through here where we're not super arched or super hunched, but typically that hunch is what's going to be increased pain over time.
Yeah, absolutely. And SH, if you want to throw into the chat a little bit more about that back posture, you're more than welcome to. But absolutely what Dr. Saya was saying in terms of making sure that it's just supported. So, what's going to support you is thinking about what's happening below that area. So, you're talking about your lower back. What's happening above it? What's happening in your posture, in your shoulders and your neck, in the upper back, and what's happening in your posture with your legs and your knees and your hips. Those are all going to play a factor. So think supported, think in alignment. You're going to, again, as Dr. Saya said, ribs over hips, ribs over pelvis. You're going to think knees in the same line as the hips, right? All of those, and you're going to think ears over shoulders. All of those things are going to help support you. So then we're moving on into feeding. But if there are other questions, shout them out, unmute yourself, put them in the chat. This is an interactive gathering tonight. So, regarding feeding positions, right? Let's talk about this. We're going to talk about sitting first. Sitting, much like what we just described before with our Thrive report, I failed to mention, but I should have mentioned because this is the best part. This mama went from having all this neck pain, all these headaches and things like that. She went from having that to having no pain. So I want to say that these things really, really, really work if we just take the time to figure out what exactly is happening. What exactly do you look like when you're doing these things? All right, so in terms of
Quick
feeding,
comment.
go ahead.
If you can, if you're like, I don't know, you can always have someone, it sounds random, but you can have someone take a picture of you. Because sometimes when I catch myself in a photo, what I think I look like and what I actually look like can be very different things. So you may notice if there's a slouch or if there's not a slouch. And you can just kind of go through the checklist like, hey, am I supporting myself? It's like, yes, your body can tell you, but also that return photo can tell you.
Oh, it will tell you every time. A lot of times we tell our clients to have someone who's around them snap a picture when they're not looking, when they're not paying attention. Just say, like, your homework for the week is to take a picture of me while I'm feeding, but you can't let me know, right? That is so helpful because then we can say, okay, pinpoint what's happening here and what can we adjust. So, we've talked a lot about the sitting posture with feeding. The most important thing is you're going to want to be supported. You can also, you're welcome, SH. You can also be reclined. So, what we mean by that is what we just talked about is the sitting posture where you're just in any regular chair or you're on the couch or things like that. But a lot of times people might have like an actual recliner chair in the nursery. So what you do when you have a recliner chair is actually very similar. You're going to still stay supported. You're going to still be supported with those pillows underneath the arm. And in this case, it's going to be even easier to really rest that head and neck backwards. This is actually a very ideal position because you then aren't tempted to turn your head down and crane your neck as so. You really are, gravity is going to help you out there and you're going to be able to recline backwards on the chair. So definitely want to note that that is a really great position. Oftentimes, though, people do opt for side lying as a feeding position. So we've got this picture here to kind of show you. You're going to kind of use your imagination to picture the whole person, but I'm going to walk you through it. So as mama, you are going to be, if you're going to do side lying, you'll be lying down on your surface. Usually it's a bed, could be, rug floor, whatever you prefer, or mat, or whatever you prefer. And you're going to set yourself up first. Dr. Say is going to be our lovely demo on the couch behind her. So you're going to set yourself up first. What you're going to do is make sure that your head and neck are supported. You're going to place your pillow between your shoulder and your ear. So not on top of or anything like that. Your pillow is designed to go in between your shoulder and your ear. All right? Then, so what I want to make sure that we're not doing here, I want to make sure that we're not holding ourselves up with our head or with our hand. So, no holding your head up with your hand. That over time is going to make these muscles very short, very tired, very angry. So, as Dr. Saiah is demonstrating right now, you've got the pillow between your ear and your shoulder, and that arm that's underneath is just tucked up under the pillow. All right. Then moving down to our hips and our legs, you want to notice Dr. Sayer right now, there's nothing supporting hips and legs. So what you see is that top leg is just kind of falling down on top of the other leg. Over time, that's going to cause some pain and issues in the lower back. We don't want it. What are we going to do? We're going to put a pillow in between the legs. Now, the main point and the main part about this is you want a pillow that is long enough. So if you are someone who has a pregnancy pillow, you're going to use it in postpartum, okay? All right. So you want a pillow that's long enough or use two pillows so that your knee and your ankle on the top leg are supported. All right. The reason we don't just want a pillow in between the knee and the thighs is because then you get a pull on your hip and you get a pull on your lower back, and we don't want that, right? So, again, think alignment. We are such sticklers about alignment, but you want your hip, your knee, and your ankles to be in one line. And if you look at Dr. Sayed, even her shoulders, right? So shoulders, hips, ankles, all in one line. All right, so that's going to be your position, and then pop the little baby right there on your chest, and you're good to go. And you can use that top arm to support their back. All right, so if there are questions about what we just went over, the feeding positions, please pop it in the chat. Please, please, please. More than happy to answer those questions for you.
And and the same things apply to when you're pregnant. You can use those support pillows. Please keep the hips, the knees, everything as supported as possible. So pregnancy and postpartum.
And particularly, we're going to nerd out for just one moment, bear with us, but particularly so because you have a lot of looseness in the tissues that connect your bones to bones, bones to muscles, all the things. And so, if you are getting this kind of rotation or stretch happening in your body, that is just kind of exacerbating that looseness, and that's what really brings on that feeling of pain and that alarm system of pain. Okay, so then let's move forward to playtime. So playtime starts from the very beginning. I kid you not, Dr. Lisa and I, we have 100% put our kids in tummy time at like 2 weeks, no lie. But so playtime starts immediately, and you as mama want to be really safe while you're doing it. Okay, so here are some ways that you can be safe during floor play. The first, floor play. Floor play. I'm gonna make sure I'm saying that very clearly so we all know what I'm talking about. So on all fours. This is a really good one because on all fours, so all fours means tabletop position. If you're a yogi like myself, I'm a yoga instructor. You're gonna put your palms facing down on on the floor or the surface up under you, and your knees are gonna be on the surface. So hands and knees. Um, if you have wrist issues, you may want to be in balled fist position. That's okay too. But that is all fours position. And what that's going to do is it's actually going to strengthen those back muscles, which is truly, truly important for a lot of things that for posture. It's going to strengthen the core muscles, which is also really important for posture. And it's also really important for lifting and carrying and things that we're going to talk about in a little bit. It's going to give you a good neck position. So when you're on all fours, tendency is to kind of crane the neck and look upwards. We don't want to do that. We want to still keep those ears in line with the shoulders, right? So that we're maintaining a good neck position. And it's going to strengthen those neck muscles if we're doing it properly. So you can get a good workout in while you are on all fours playing with little one. And that's more so, if you have a crawling infant, around those time frames. And if you're on all fours, you can start to do some crawling, and baby's gonna watch, right? Baby's gonna be observant and kind of pick up on what you're doing. um, the next thing we want to talk about is stool sitting. So in this picture here, it's a perfect example of stool sitting where mama is sitting on a surface that's not too high, not too low. She's still able to maneuver and manage and pick up baby, and at the same time, she is maintaining that her knees are in line with her hips, and she is sparing her lower back. So, very, very good for supporting the infant, playing with a toddler. You want to think about doing this when maybe you have an infant that has good head support. Next, we'll talk about Sphinx pose. So, again, throwing a yogi term out there, but essentially that is just you're lying on your stomach. All right, so you're lying on your stomach, and then as you're lying on your stomach, you're gonna slide those palms forward so that the elbows are right up under your shoulders, right? So that's Sphinx pose. So your body's kind of gonna look like so. All right, like so, or like how Dr. Saiah is doing. Great, thank you. So in Sphinx pose, again, this is really good because the back muscles are engaged, right? You're getting a good workout in those back muscles. And at the same time, you're getting a good stretch in that front body. So if you're someone who has had a cesarean section, a C-section, or any abdominal tissue, scar tissue that needs a little bit of massage, you would be a really good person to do Sphinx pose because it gives you that gentle stretch that you need, even that gentle massage of the scar tissue that you need to kind of be able to use your core muscles well. And then finally, we're going to talk about side lying. So, very similarly to what we talked about with the feeding position, now we're getting into it while you're playing with baby. And the cool thing about the side lying is it's a great side body stretch. So, again, imagine yourself lying down on your side. You're really stretching out the lat muscles, which are on the side of your body here. And it's also a really good position to do some hip exercises. So if you've ever been prescribed like clamshells or side lying leg raises, that's a really great time to do that while you're on the floor playing with baby. So these are 4 things that you really can use in floor play in order to be able to help yourself out and decrease any risk of having some pain or discomfort and things like that. So we've talked about all the posture and best ways to have some really good pregnancy posture. We've talked about going into positioning and feeding and play. And so now we're going to get into postpartum and talking about how to support your body.
Yes. Also, I loved your comment on doing your exercises and sideline. Usually when I see moms in postpartum, many times Tiny One comes with them. So we end up having to work with Tiny One on the floor. I'm like, all right, so let's try to do this exercise while your Tiny is occupied. Oh, we're on a break. Okay, let's get back to it. And so it is. It's a great position to get. I'm gonna say to get tasks done while also engaging with baby. Okay, so we say the first 6 weeks and even beyond that 6 weeks of postpartum can be a delicate time. And so sometimes I'll see folks and they're afraid to move. And so I usually tell people we want you to move, but we want you to get back into activity, movement gently. And a lot of times, exercise looks like getting back into your daily life functions, but engaging the right muscles as you do so. And so, one thing that I know I can't even say the vast majority, the moms are doing is lifting Tiny One on and off of the floor. And so I tell people in that postpartum time period, whether you birth Tiny One vaginally, whether you have a cesarean section, your pelvic floor, your core, those muscles are in recovery. And so they're now no longer being as stretched out, but they're trying to regain strength in their ideal positionings. And so I like to tell moms, you want to be mindful of how you are picking up your Tiny in order to not promote back pain, but also to allow the right muscles to support you and to allow those core muscles and the pelvic floor muscles to get back on track. So I'm gonna change my background a little bit. You are welcome to move with me, but you do not have to. First, I'm gonna show you the do not do's, and then we'll practice the what to do together. Okie dokes. Okay, so when it comes to proper lifting, what can be very tempting is to round out the back. Whether you have a toddler or whether you are working with an infant. For my toddler mommies, I'm like, no, we don't want to see your whole back collapse when you go to get little one. For my infant mommies, what we also don't want to see is the whole back going down to get your Tiny One. So we'll say the one rule of thumb for today. We want to keep a nice flat back. So if you are leaning forward, we like to keep a nice neutral on the back. So we're going to say lean from the hips. So if we're here, okay. Say you're getting Tiny One off the floor. You go to reach. This is Tiny One for today. You go to reach down. We are in a half kneel. You go to reach down. You kept that back. You might get a little bit of bend at the end, but you kept the back nice and flat for the most part. Once we get here, we are holding Tiny One. Okay, y'all, we know it's not quite the hold you imagine with this pillow shape. After you are coming from the kneel, I tell the moms to, let me bring this down just a little bit. You want to tuck that back leg, so tuck the toes, and then you really using those hip muscles, you want to push up into standing. And so I tell moms, if you feel the pain and the pulling in the back, likely the back is straining. Your hip muscles are going to be your big movers. So when you're going from that kneel to stand, really being mindful of what our back is doing. So flat back, go ahead and grab. We're going to do it one more time. Resting Tiny One, if they're big enough. Like in the photo, if you got a big kid, they can sit up. If not, if you got a little tiny, you're going to be holding. Tuck that back leg and really press up, keeping weight through both legs, using those legs to stand up.
Make sure that as you're doing this, you guys, if you forget anything as you're doing it, think about pushing through that front heel, so the heel of the front foot, right? And that's going to make sure that you're using the back muscles, like the hip muscles, the glute muscles that Dr. Saiah was just mentioning. But think about using your leg muscles most importantly, because they're your biggest muscles in your body, and they actually make the most impact on your movements.
Yes, Dr. Val. One more note to that point. If you wanted to, do practice on keeping the back nice and flat. Sometimes what we'll tell our mommies, keep the weight nice and even through the legs. And then I tell my moms, slide the hands down the thighs, pushing the bottom back. And then not looking straight up ahead, but just keeping the chest up a little bit. And typically, if you're here, it's a little bit easier to keep the back flat. And so, whether you have one leg in front of the other, you're still here, keeping the back nice and flat, or
Mhm.
whether you have both legs. And so, most of your movements are going to stem from there.
And so
Dr.
social,
Val, I see you.
yes. So, well, Social Mondays just mentioned that that position creates tension in the knees and not the hips. So what to do? Great question, because the lunge is actually not going to be for everybody.
That's correct.
At the same time, there are things that you can tweak. So if you look down and your knee is pointing inwards towards your midline of your body, that front knee, that can cause significant tension and pain in the knee, and you do want to consider your alignment. So look down and make sure that that knee is in line with the hip. But there are every body is different. So instead of a lunge, there's the full kneel, or there's also a hip hinge that Dr.
Yes.
Saiah just mentioned, but the in a squat. So I'll let Dr. Saiah kind of go through a couple of those.
For the squat, typically I say this is a lot less stable, so can be a little more challenging. And if we mention tension in the knees, I don't know if the squat is going to be the most ideal. But if you do need to do the squat, I do tell people typically your heels are going to be off the ground. So I don't typically encourage, I have a lot of moms who do this, but you can pick up tiny from here. And then as you're coming up, flatten the feet against the ground and come up. But if you were in the squat, we still don't want that back to collapse here. Here, where the back is rounded, is going to be where we cause the most back pain. No, I don't want the knees to hurt. But even if we can sit our posture up a little bit and then lift, or for our bigger or tinies, for the toddler age group, that's when we're doing the hip hinge. And in order to not get a lot of stress on the knees, I typically will stress bottom back and a slight bend at the knees. So if you notice, the hips are going to be doing the most work here, and you can get pretty low. It is going to take a couple practice rounds. Let me know if that helps or if it doesn't.
We got a little heart, so I think it's going well. And let us know if you have no problem Social Mondays, and let us know if you have any other questions. The really key here, though, as Dr. Sayers is about to mention, is the breath and the core. So
Oh, I'm
definitely,
glad you
you
said that.
can't, yeah, 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 definitely, you cannot do these activities without thinking about the breath and the core.
And so, when we talk about the breath and the core, I tell people when you're working out, when you're lifting tiny, you want to breathe out on the hardest part. And yes, I'm sure the hardest part might be debatable, but for today, we're going to talk about the hardest part being as you actually lift. Sometimes people do, oh, and try to lift and hold their breath. So, in our other master classes, you may or may not have seen, we talk about as you breathe out, tighten the low belly in. So if you're standing or seated, you're welcome to rest your hands below the belly button. Nice inhale through the nose. As you exhale, tighten low belly into the spine, almost like you're trying to tighten to put on snug jeans. And so we're going to pair this motion, if it's not too many things going on at once. If it is, just breathe out. But as you reach down to pick up tiny, so we're breathing in as we reach down and then breathing out, tighten those bellies toward the spine, and now we're up. And so that core tightening is going to activate one of the deepest layers of your core muscles and helps to stabilize the spine a bit more. So I'm always going to say breathe out, belly in. Not when you're casually standing during the day. Please relax your belly. But if you are lifting, breathe out, belly in.
Mhm.
Thank you, thank you. Okay. And so, and my last note, we want to keep things as even as possible, nice and balanced as possible. So on this slide where it says support yourself, there are various ways to wear the timies. Y'all, give me 1 sec. I'm gonna put my background back on. Um,
So while Dr. Say is putting her background back on, I just will say there are so many different carriers, right? So many different things. So we're not going to go into every single one today, but we are just going to kind of note the how they can be helpful, how carriers in general can be helpful for you.
yes. So for the carriers, a lot of times if you're trying to complete multiple tasks during the day and your tiny is not feeling being away from you, you can always wear them. It's gonna help keep the weight nice and centered versus holding the baby on the sides, leaning on one side or the other. So that symmetry is already a little bit less stressed. Because if you notice, if you're holding tiny all day here, eventually one side of the back or the other is going to be aggravated. But wearing tiny one, whether on the front, whether on the back when they're a little bit bigger with better head control, can keep our weight nice and centered. And it starts to give our muscles a break versus trying to reposition. There are some carriers that can support you where you wear tiny one on the side without having to do the extra hip bump and things like or in other weird bodily postures. And to that point, if you are local, and so check out the slides, of course, and see there are a few different options and styles. But if you are local, Dr. Lisa is going to be running an event in DC. If you're not, still be on the lookout for future baby wearing virtually. But Dr. Lisa is going to be teaching hands-on baby wearing strategies just to keep you comfortable as your tiny one grows. And so she is going to be showing some of the more common carriers like the Ergo 360, the Tush Baby, the Baby Bjorn Mini, and more. And so if you are in the area, we would love to see you. And if not, be on the lookout. But we are aiming to share some invaluable insights and foster a supportive environment for growth and learning.
Absolutely. And then Social Mondays, real quick. I know that you mentioned is this if putting tiny in baby carriers is good for their hips. That's a really good question because babies are not fully developed when they come out of the womb, to be honest. So their bodies are still developing, and there's concern, right, that their hips would dislocate or come out of place. Um, Less so now because there are carriers that grow with babies. So there are infant carriers that you can use from day one, right? And there are cloth carriers and things like that. So, and those carriers will allow baby to take up their natural positioning and or not spread their hips too far apart. So, you're right. Yes, this one's about mamas. But if you're in DC, please come to our event next week so we can give a little bit more insight on that, or feel free to send us an email or something like that. We'd love to chat with you a little bit more about this. So speaking of which, inside, what is even the Balanced Mama Project? And you're very welcome, Social Mondays. What is the Balanced Mama Project? So we work with pregnant women and postpartum women with urine leakage, prolapse, and or mild depression and anxiety, and we move people through having pain or stress. When you think about pain and stress, I know when I am in pain or I'm stressed, I don't really have great relationships with people because I'm snapping. I don't have a lot of patience, right? We move people from having pain and stress. We decrease the stress. We prevent the pain or decrease the pain. We move it into having better relationships, not only with yourself, but also with others, also with your spouse, also with your kids. And all of that really brings you more time for joy, more time for peace. And so we again are all licensed practitioners. We all have training, extensive training in maternal health and obstetrics, and pelvic health, as occupational therapists and physical therapists. We're giving expert advice, we're giving proven practices here, and everything is really easy to follow. We get it, moms. Nobody has time, right? Ain't nobody got time. So our guides are just really simple, really quick, really easy, similar to the things that you walk through with us today. Very simple, but they're going to affect change and make a world of difference. And we do one-on-one sessions. So we work with pregnant and postpartum women in one-on-one settings, from multiple specialists, and that's so that we can really give you that specific advice, that specific coaching that you might be looking for in order to get to where you're trying to go. So, the next thing that you can do from here is to book a call with us. So a call with us, it's not anything that is scary. It's just having a conversation, honestly, to see what you are looking for. And if you are the person right now who is looking for more freedom, looking for more confidence with your movement, if you're looking for peace in your life, decreased pain, peace, if you're looking to feel secure in this new identity of being a mom or being pregnant and what does that mean, then we invite you to book a call with us because we have seen tried and true clients going from feeling like they are really kind of down and out or not quite sure where they stand in their life right now or feeling like they're in pain to feeling like they are absolutely thriving. And so we are definitely open to hearing from you. If you are that person who wants to go from having pain to thriving, please book a call with us. We're gonna actually put
The
the
link is coming
link in
shortly.
the chat. No worries,
I'm
I got you.
struggling with the share.
No worries, I got you.
Thank
So we're going to put the link in the chat. So you are more than welcome to book a call with us. It's just a 30-minute one, so no stress, no pressure. One thing I will say too is that you just remember that small shifts make a really huge difference. So we really just want you to feel great right away and be able to put all of these practices in place right away. And so, because of that, we're actually going to share with you our free PDF for mom moves. So all of these moves, all of these play and positioning and posturing things that we talked about today, because you showed up here today, you get this free PDF. Nobody else gets it, you get it. So feel free to check out that Google Drive link that we just popped in the chat. And if you are ready to keep it moving and feel confident and feel pain free and feel like you are just thriving and succeeding at things, book a call with us. Now, we want to leave room for questions. Ask us anything. We are open books. As you
you.
know, we are really passionate about these things, so we love to talk about it. Please ask us anything. We thank you so much for joining us today.
Thanks.
Yes, and the call is free, Daria. Absolutely.
Oh
Absolutely,
yeah.
the call is free.
Yes.
We literally, so let me back up a bit and share a little bit about what even happens in the call. So honestly, it's Dr. Saiah and I, and we get a chance to just sit and listen. First and foremost, we listen to you. We want to hear what are your concerns? What are you working through? Where do you want to get to? And we walk you through, okay, cool. So what does it look like for you to get to that point, that position, that point, that goal? So it's really a conversation and it is absolutely free. Bring your tea, bring your coffee. It's free.
Yes. Thanks so much for joining, y'all, and for the questions throughout. I'm glad that you asked as we were going. And congratulations for the new tiny ones to come and for the ones recently arrived that have recently arrived.
Yes, yes, yes. We're sending all the positive vibes.
Thank you guys for a great presentation. I do have a quick question.
Yes.
Um, do you have any tips for bath time? I mean, I can already see my back killing me from like bending over the tub for bath time.
It's a real thing. So, yes, I think Dr. Say and I probably both will tag team on this question.
Yes.
In the beginning, it's a bit easier because they're bathing pretty much in a sink, so it's really nice because you get to stand up. I will say, as you're standing though, make sure that you're in a sink. You're at a sink that is not super low. So you think about like the kitchen sink. A lot of times people like to bathe the baby in the kitchen sink, do you, but it is also very low. So you want to get a sink and a surface that's going to allow you to stand up nice and tall, stand up in your normal standing posture so you're not leaning over for so long. And then of course, as baby grows, they'll be in one of those baby tubs that you can put inside the bathtub. And again, think stool. So you can put a
Yes.
stool in the bathtub with you and then sit on that stool and lean and hinge forward on the hips, right? And Social Mondays was mentioning too a bathtub stand. Oh
I
yeah.
love the share. I
Oh
love the
yeah.
share.
Yeah. Okay, I'm gonna have to look up a bathtub stand too. Yes, social Mondays. Thank you. Absolutely. So hopefully that answered your question, and I'm gonna let Dr. Sayer chime in if she has anything else.
Oh, because I know people can't like the sink side. Your sink is where your sink is. So if by chance your sink is on the lower side, so I too am gonna have to look up the bathtub stand. That's making me smile. But also, if you, I guess I don't have to get up to do demo. If you have a stool to even place your foot on, if you are at the sink and you do have to bend a little bit lower, that typically takes stress. Y'all, the disappearing is crazy.
I
It's
know.
okay.
We try to be
If you,
efficient with these backgrounds, and it doesn't let us just demonstrate.
it's not letting us be great.
But
Um,
essentially, what she was saying is just, oh, there she goes.
if you have a little stool or something, I'm gonna use this chair as my stool. A lot of times, if you prop a foot up, and I'll even tell folks when they're doing dishes, other chores, things like that.
Hmm.
If you prop a foot up, it takes a lot of stress off the back. So versus you trying to be here and move, you'll have the foot prop, and then you can shift your weight using the hips a little bit, and then kind of move with baby. And so that does typically take some stress off. You can switch feet if you need to. Um, okay,
Yeah,
that
I
was
would
my
say
summary.
definitely that's a good tip, Dr. Say. And then I would say definitely switch the feet. Don't have the same foot up each time you bathe, each time you give the baby the bath. Hmm.
Good
Awesome,
question.
thank you.
Yes, yes.
You're so welcome. If anyone has any other questions, please reach out. We are so happy to share this information. We are so passionate about it. And we look forward to chatting with you guys on our one-on-ones. And so have a great rest of your evening, night. If you're in the UK, get some rest.
Please do get some sleep. And thanks. Be on the lookout for other classes to pop into. Okay, bye.
All right, thank you. Bye.
Bye.